It's a pleasure to be with you. The title of this session is Origins of Public Health, Part 2. There are no disclosures for this presentation. Objectives include review the emergence of public health social justice due to industrialization in the 19th century. Review the 3 public health practice efforts emerging from the Industrial Revolution. Discuss the 4 public health responses to contaminated water and inadequate sewage handling and how these responses helped control infectious diseases. Review the history of sewage handling and treatment. Review the history of water disinfection and its impact on the control of infectious diseases in the 20th century. Discuss what laws, policies, rules, and regulations are and how they relate to each other. Review major U.S. drinking water and wastewater treatment laws. Discuss the history of antibiotics and their impact on lifespan in the 20th century. The unhealthy living and working conditions, like those in the coal mines and factories, including child labor abuses during the Industrial Revolution, provoked demands for change. Protection of children and women became a cause for many progressive leaders. The following excerpt from a poem written in 1836 by Carolyn Sheridan Norton to present in Parliament is an example of the sentiments held by many about child labor practices in Britain at the time. Prefacing the poem, the author stated, "The abuses even of such a business must be cautiously dealt with, lest in eradicating them we shake or disorder the whole fabric. We admit, however, that the case of children employed in the cotton factories is one of those that call fairly for legislative regulation." These, then, are his companions. He is too young to share their base and saddening merriment. Sits by, his little head in silence hung, his limbs cramped up, his body weakly bent, toiling, obedient, till long hours so spent produce exhaustion slumber, dull and deep. The watcher's stroke, bold, sudden, violent, urges him from that lethargy of sleep, and bids him to wake to life, to labor and to weep. But the day hath its end, forth then he hies, with jaded, faltering step and brow of pain, creeps to that shed, his home, where happy lies the sleeping babe that cannot toil for gain, where his remorseful mother tempts in vain with the best portion of their frugal fare, too sick to eat, too weary to complain. He turns him idly from the untasted share, slumbering sinks down unfed, and mocks her useless care. The author added this note for those in Parliament: "I earnestly hope I shall live to see this evil abolished. There will be delay, there will be opposition, such as ever been the case with all questions involving interests, and more especially where the preponderating interest has been on the side of the existing abuse. Yet as the noble-hearted and compassionate Wilberforce created the dawn of the long-delayed emancipation of the Negroes, so, my Lord, I trust to see your name enrolled with the names of these great and good men as the liberator and defender of those helpless beings on whom are inflicted many of the evils both of slavery and imprisonment." Another result of industrialization was the loss of jobs for thousands, with the transition from manual labor to mechanization forcing many English families into poverty. This transition resulted in worker protests and violence as recognized by a famous speech by Lord Byron before the House of Lords in 1812. During the short time I recently passed in Nottingham, not 12 hours elapsed without some fresh act of violence. But whilst these outrages must be admitted to exist to an alarming extent, it cannot be denied that they have arisen from circumstances of the most unparalleled distress. The perseverance of these miserable men in their proceedings tend to prove that nothing but absolute want could have driven a large and once honest and industrious body of the people into the commission of excesses so hazardous to themselves, their families, and the community. They were not ashamed to beg, but there was none to relieve them. Their own means of subsistence were cut off, all other employment preoccupied, and their excesses, however to be deplored and condemned, can hardly be subject to surprise. As the sword is the worst argument that can be used, so should it be the last. In this instance, it has been the first, but providentially as yet only in the scabbard. The present measure will indeed pluck it from the sheath. Yet had proper meetings been held in the earlier stages of these riots, had the grievances of these men and their masters, for they also had their grievances, been fairly weighed and justly examined, I do think that means might have been devised to restore these workmen to their avocations and tranquility to the country. Through the public's outcry over working and living conditions in England, especially for children, during this period of industrialization, we see the emergence of a public health sensibility or commitment to social justice. The belief in the importance of equity, fairness, and human dignity. This commitment to social justice is at the heart of public health practice. All people deserve equity, fairness, and dignity, regardless of their power or wealth. So modern public health practice emerged in response to the sobering social and physical problems encountered with industrialization during the health protection and hygiene movement public health eras that spanned time from antiquity through the 1870s. Let's now consider the history of a few major public health practice efforts developed since the Industrial Revolution, including response to infectious disease outbreaks, response to injuries and non-infectious diseases, and the development of the field of epidemiology. Provision of clean water and safe handling of sewage were major early targets to control infectious disease outbreaks. As city populations grew in the 18th and 19th centuries, contaminated water and inadequate disposal of sewage were often associated with outbreaks of diseases like typhoid fever, cholera, hepatitis A, non-typhoid salmonella, E. coli, amoebiasis, and giardia, etc. The London cholera outbreak, studied by Dr. John Snow in 1854, started the field of epidemiology. The public health response to these outbreaks of waterborne diseases focused on environmental engineering, modifying the environment for all people at risk, including development of sewage disposal systems, sewage treatment plants, water treatment, and regulation. Early sewage systems, like that in London in the 1800s, as illustrated on this map, simply carried human waste out of the cities and dumped it into rivers, polluting them. By the 1850s, London dumped more than 400,000 tons of sewage per day into the Thames River. In the mid-1850s, Chicago built the first sewage system in the United States, soon followed by many other U.S. cities. The first approach to sewage treatment was through a process called self-purification that takes place when small amounts of sewage are discharged into a large body of water like a stream, river, or lake and self-cleansed of pollutants. Self-purification involves physical, chemical, and biological processes. The physical processes include dilution, sedimentation, filtering, and aeration. Chemical processes include oxidation and reduction. Biological processes include mineralization and assimilation. Most cities generate large quantities of sewage that's far beyond the capacity of self-purification in bodies of water, making it necessary to apply other treatments to help reduce wastewater pollutants. Sewage treatment plants for cities were first constructed in the late 19th and early 20th centuries. So instead of discharging sewage directly into nearby bodies of water, it is first passed through a combination of physical, biological, and chemical processes that remove some or most of the pollutants. The history of drinking water treatment dates to antiquity. Early Greek and Sanskrit writings suggested that filtering water through charcoal, sunlight exposure, boiling, and straining would improve the taste and odor of drinking water. The first documented municipal water treatment plant was in 1804 in Paisley, Scotland, where sand filters were used to purify water. In the United States in 1908, Jersey City, New Jersey, was the first city in the United States to disinfect community drinking water using chlorine, followed by numerous other cities and towns, resulting in a dramatic decrease in waterborne diseases across the country. Today, American drinking water is among the safest in the world. The most common disinfectants used to treat public drinking water are chlorine and chloramine. The Centers for Disease Control and Prevention, CDC, noted that the treatment of public drinking water to control infectious diseases is one of the 10 greatest public health achievements of the 20th century. Water and sewage systems did not emerge spontaneously, but were created and authorized by laws, policies, rules, and regulations. Let's review briefly what laws, policies, rules, and regulations are and how they relate to each other. Laws are created by legislative bodies and cannot be altered without legislative action. Laws define policy parameters. Policies are developed by agencies, departments, and organizations to accomplish goals. Policies can be changed and adjusted, but must comply with existing laws. Policies can inform the development of laws through legislation. Rules and regulations are developed by agencies, departments, and organizations to implement policies. Policies must be enforced to be effective. Let's review a few key U.S. drinking water and sewage laws that result in policies, rules, and regulations. The Safe Drinking Water Act was a federal law passed in 1974 to protect the quality of drinking water in the United States. This law focuses on all waters actually or potentially designed for drinking use, whether from above ground or underground sources. This law authorizes the Environmental Protection Agency, EPA, to establish minimum standards, policies, rules, and regulations to protect tap water and requires all owners or operators of public water systems to comply. For wastewater, the Clean Water Act, CWA, of 1972 established the basic structure for regulating discharges of pollutants from wastewater treatment facilities into the waters of the United States and regulates quality standards for surface waters. The EPA developed the National Pollution Discharge Elimination System, NPDES, under the authority of the Clean Water Act, which is an EPA program that authorizes state governments to perform many permitting, administration, and enforcement aspects of the program. Enforcing environmental laws is a central part of EPA's strategic plan to protect human health and the environment. EPA works to ensure compliance with environmental requirements. When warranted, EPA will take civil or criminal enforcement action against violators of environmental laws. Another major health intervention that impacted the control of infectious diseases in the 20th century included the development of antibiotics. Let's briefly review antibiotic history. Ehrlich and Hatta discovered arsphenamine salvarsan, which was marketed in 1910 to treat syphilis. In 1928, Sir Alexander Fleming identified penicillin, a molecule produced by a green mold, Penicillium rubens, that killed or stopped the growth of certain kinds of bacteria. Sulfonamides were developed in 1932 by Domek and Horline and were active against many gram-positive cocci. The discovery of sulfonamides initiated the antibacterial era. Ernst Chain, Howard Florey, and Edward Abraham succeeded in purifying the first penicillin, penicillin G, in 1942. Penicillin G had potent activity against a wide range of bacteria with minimal human toxicity. The development of penicillin opened the door for antibiotic research and development. The term antibiotic was first used in 1942 by Selman Waksman and literally means against life and includes any medication that kills pathogenic bacteria or inhibits their growth. The antibiotic era was born. This slide demonstrates the major families of antibiotics and their usage against various microorganisms. This is not by any means exhaustive. The development of antibiotics has had a major influence on the treatment of infectious diseases worldwide. Antibiotics are among the most important advances of medical science during the 20th century and may have added 5 to 10 years to U.S. life expectancy at birth. The CDC estimated that the lifespan of Americans increased by approximately 30 years from 1900 to 1999. So the impact of antibiotics may be attributed to 17 to 33% of the increased lifespan in the 20th century, leaving 66 to 83% to other interventions, mainly those associated with public health primary prevention. Medical advances, including antibiotics, are extremely important and increase the health and wellness of people. Yet public health interventions, like primary prevention programs to control infectious diseases through clean water and wastewater treatment interventions, vaccinations, provision of safer and healthier foods, maternal and child health, tobacco prevention, etc., had an even greater impact in the 20th century. In summary, industrialization resulted in the commitment of public health to social justice issues. the belief in the importance of equity, fairness, and human dignity. Provision of safe drinking water and wastewater treatment helped control infectious diseases in the 20th century. Control of infectious diseases was one of the major public health achievements of the 20th century. Antibiotics improved the lifespan of Americans by 5 to 10 years, and public health interventions by 20 to 25 years during the 20th century.